Hey, everybody. Welcome back into another edition of the drbicuspid.com podcast. My name is Kevin Henry. I'm the editor in chief for Dr. Bicuspid. We're going to talk about some things that our sister publication, AntMini.com, might be interested in as well today. And we're going to do that with Professor Don Tyndall. Dr. Tyndall, how are you today?
I'm doing very well. Thank you.
I'm excited to have you on. I'm excited to talk about this new technology that is coming into dentistry. But before we dive into that, I'd just love for us to know a little bit more about you, if you don't mind.
Yes. Well, I'm obviously Dr. Don Tyndall. I work at the University of North Carolina, Chapel Hill, Adams School of Dentistry, and the Maxillofacial Radiology Division of the Department of Diagnostic Sciences. I know it's a long title. I've been here 46 years. I'm actually retiring July 1, but I'm coming back to work half time. I love what I do. And part of what I love is getting to do research in different areas of advanced and emerging technology, which is one of the reasons I've been involved with the dental dedicated MRI system.
And I'm so excited to talk about this. I got a little sneak peek of it at the IDS meeting in Cologne, Germany back in March.
Yes.
Uh, and again, we're linking to this in the show notes. We've published the release on drbicuspid.com, where
Good.
Dentsply Sirona and Siemens work together on this dedicated dental MRI. And let's start with a big 30,000-foot view question here. For our dental audience, can we just kind of talk about what MRI is and maybe how it could impact the dental industry?
Yes. One of the chief features of dental MRI or any MRI unit, it has much more versatility in what it can see. Just kind of going over the basics, the elevator conversation about how dental MRI works. You put a patient in a strong magnetic field, and then you pump radio waves at certain frequency, depending on the piece of anatomy you want to look at, that energizes some of these protons, gets magnetized. And then you turn off the radio waves, and much of that energy is re-emitted and picked up by a receiver coil. It's a simplistic way of saying it, but basically you're turning the patient into a radio transmitter. So radio waves go into a magnetized field, and then radio waves come out. That's the very simple description. But in that, you have so many variations of sequences of radio waves, different like at this frequency, that frequency. So you want to locate it in three-dimensional imaging, and you also can time the sequences differently. In other words, you have literally over 100 ways you can put different radio frequencies and different radio strategies, I might say, into the patient and get more information out. So when we look at X-ray technology, you're basically looking at X-rays that are being absorbed or not absorbed, and they come into a detector. And so you can see bone with medical CT, some soft tissues, and you can see teeth, of course, but you're basically getting one type of image information. With MRI, you have many, I would call, channels of information, different sequences like proton density, T1, T2. There are a number of these sequences that can be used that give you different kinds of information. So you can look at the same problem. Let's just take a cone beam scan. You've done a root canal, and you see maybe a year later there's a little radiolucency at the apex. Well, is it still inflamed? You can do a little bit of testing. How do you know it's just not an apical scar? Well, MRI is great at detecting inflammation. So to have an MRI scan, which the time has been cut down quite a bit since a couple of years ago, you can have this scan and it'll show, is there inflammation? There'll be a bright signal there. Whereas before with cone beam, you just see a little radiolucency. So I think one of the greatest things that dental MRI, or I would say dental dedicated MRI, offers is the ability to accurately depict inflammation. Whereas cone beam, you can see bone loss or bone gain, but you can't see active inflammation. And that's one of the biggest advantages. Dental MRI itself, and by the way, when I say dental MRI, it's just read dedicated dental MRI, because this is a system dedicated for dentistry, although it obviously has some other purposes that can be used, such as temporomandibular joint imaging, which is kind of MRI has been the standard for quite a while. But with this type of imaging, you can detect lesions more accurately, inflammation. You can also detect pulp vitality. Just say a patient comes in and, well, it hurts here, it doesn't hurt here. You're not really quite sure what tooth's involved. MRI can show you which one's the inflamed one, or if you have a vital pulp or not. And some sequences, you can even detect maybe there's a tooth fracture and there's a little bit of fluid. And by the way, fluid is water. It's basically is what's being energized here. You might be able to see in some cases some cracks in a tooth, not maybe not by the physical crack, but by the water that's in that crack or the fluids, I would say. So I think the biggest advantage for dental dedicated MRI is going to be identification of inflammation, but it doesn't stop there either.
I'm sure not. It sounds like there's so many uses that it could be put in place for. Is this something that you see in the future actually being in dental practices, or would this be something that's more university based? What are we looking at in terms of the rollout of this in
Yeah,
your
it's
mind?
a great question and a very relevant question, of course. I think at first you're going to see it in universities or maybe military bases or large DSO organizations where you can have a central facility. Right now, the dental dedicated system being developed is using the Siemens Freemax. Now, the Freemax means sort of free of helium. Without getting too much into details, magnets have to be basically super cooled just a few degrees above absolute zero. That way they're superconducting, so you don't have to keep pumping electricity into them. And it requires a lot of liquid helium to do this. And there are issues with that. The Freemax, the helium, if I could use the word, is baked in, so to speak. It's inside the magnet and it's closed system. So instead of like 6 or 7 liters of helium to cool the magnet, now you've got point 0.7 liter. And they're not making a whole lot of helium lately. So I think this is going to be the way of the future for all MRI eventually. But so you're cooling it down with baked in or it's inside the system. And that gives you the magnetic field strength you need in order to have MRI to work.
I'm curious because, we in dentistry have talked for so long about how we're having to educate the patient on what comes
Yes.
next. And in my mind, and correct me if I'm wrong, this is something that dentists and team members will need to be able to communicate to the patients about why an MRI might be needed and the benefits of it as
Yes.
well.
Yeah. Let me back up and finish what I was getting ready to say. I didn't
Well, I
finish.
apologize.
No, no, it's not you. It's just I got off on a tangent about the MRI system. Yeah, when will it get into general dental practices? Again, it's a very good question. I think they'll be working on at some point a smaller unit because right now this Freemax is smaller than most MRI system. It's 0.55 Tesla, whereas most systems in medicine are 1.5 or 3.0 Tesla. So it's a little bit smaller. The bore or the size of the compartment is larger actually than most systems. So there's less claustrophobia. So I think it'll be slow adoption like cone beam CT was. I'm not sure if it'll be as ubiquitous as cone beam is now. But when I started teaching way back in 1980, uh, I would have told somebody who said, "Well, we're gonna have CT scans at dental offices by the year 2000 or 2020." I'd say, "I don't know what you're smoking." But so you don't know. The future is very hard to predict. But at this point, I think it'll be used mostly universities or large facilities, military facilities. And that'll be important because we need to do research to show what is this good at doing? What can it do better than cone beam? There's already research showing it can do everything cone beam does. So you're not, I suppose you could just have an MRI unit, but I want to caution people that this MRI, dental MRI is not going to be replacing cone beam CT any more than medical MRI has replaced medical CT scanning or even two-dimensional images. But it'll be something I think as people find out its uses, there'll be more people interested in it. And this is what happened with cone beam CT. We'd hear, oh, I don't really need it, this, that, and the other. Now you wouldn't put an implant in without it.
Absolutely.
A lot of surgeons say, I use it to look for, third molar evaluation where the nerve's pretty close. The other thing that dental MRI can do, it can show the lingual nerve, which is of great interest to all surgeons because there's a lot of damage to the lingual
Absolutely.
nerve. It's in soft tissue. And we've just finished a study here where you can actually see the lingual nerve. So that's another example of things you can see that cone beam can't see. So how do you explain it to patients? We're going to maybe have an MRI. Wait a minute, I don't have joint problems. They think of the usual MRI, but no, I think the fact that this will identify inflammation, it might identify areas of pain it's hard to identify. There's something called neurography where inflamed nerves light up. Dental dedicated system isn't there yet, but it's in other other MRI units. So I think one of the biggest things with dental dedicated, we start here with this application, but then we find out more and more what it can do. And we benefit from any advances that are going on in the medical MRI world can add to it, just like with cone beam CT. If you bought a unit in 2010, and kept the same unit by 2020, it's probably a better unit because of upgrades, different software, different enhancement features. I think we'll find the same thing, if not more, with MRI. Again, you've got so many different sequences and protocols, we call them, that you can use to identify these different. You can even see caries with MRI. Not really recommending you get your bite wings from dental MRI yet, but you can actually see the caries. You can see bone loss very well. Again, you can do everything that cone beam can do. Some of the studies that are coming out of the University of Aarhus in Denmark, that's who I collaborate with Professor Ruben Spinetto. We're able to see edema in the bone. We could see inflammation in the gingiva. We're able to see edema in the bone before there's any periodontal bone loss.
Wow.
So, the sooner you get that kind of information, the more effectively you can treat the patient. So it really will, I think it'll enhance patient care, bottom line.
I'm fascinated to see where this goes. It feels like right now in dentistry we have such a growth of technology with all the AI that's coming in
Yeah.
and
Yeah.
so many things like this. Is there a way that maybe those two play together in your mind?
They'll have to, I think. Well, for one thing, one of the ways that Siemens has taken a 0.55 Tesla unit, which usually low field of strength means low image quality. Well, they're using deep learning from AI to improve the image quality. So that's going to be a help. I think dentists will need the AI as well because well, we could use it for cone beam and two-dimensional imaging. In fact, I just gave electron AI to all the graduate students here. But there's a lot more to see in AI. You've got soft tissues. And I think AI is going to combine with the dental MRI, not just for image quality improvement, but also identifying all the different tissues. Right now, cone beam can segment teeth, bones, sinuses. Well, I imagine with MRI, you'll be able to segment muscles, nerves. I'm talking a little bit about the future right now. But, again, things will continue to improve. One question that often comes up, well, the MRI tech's pretty well trained. How's a dental assistant or a hygienist? How's the dental team going to be managing this?
That's where I was going. You're reading my mind, my
Yeah.
friend.
Well, it's
Absolutely.
a very relevant question and a very important question for people that would like to adopt this technology. Well, there's university work going on at Aarhus, the University of Minnesota, and the University of Dortmund in Germany. And one of the goals of this research is to figure out, well, what sequences work best for periapical lesions, for pulp vitality, for tumors and cysts. And by the way, these units can also be used to differentiate tumors from cysts as well. So they'll figure this out. And then the plan is you create icons. You want to look for caries? Button. You want to look for perio? Button. You want to look for all of these? Push this combination. So it'll be more push button than it is right now because it does take a certain amount of expertise to operate these systems. But I've already seen they've been doing some work on this so that it'll be more easily adopted. And let's face it, people don't use technology that they can't understand and don't know how to work. And we've seen that with cone beam CT. And some people buy these units, they don't get any or much training, and so they stop using it. So it's going to be a very important feature to have sort of a icon driven rather than having to know all the different sequences.
I feel like this is a conversation we could have for a couple hours, just diving in on what
Yeah.
would be and where we're going. So we're going to make sure to put a link to the release in the show notes. Again, this collaboration with Dentsply Sirona and Siemens. And Dr. Tyndall, if it's all right with you, is there a way that people could reach out and ask you questions if they want to kind of pick your brain about what might be to come?
Of course. Well, my email is pretty easy. The easiest thing is just Google my name.
And we can put that in the show notes or in the article. So easy to find.
It's Don_Tyndall at UNC, University of North Carolina.edu. And I'm happy to answer questions. One of my great joys in life is teaching and making the technologically challenged or diagnostically challenged questions simple and to make them understandable. That's a lot of my job is doing just that. So I'm happy to do that.
Well, I appreciate you've spent a few minutes teaching us today
My
about what
pleasure.
this is and what it could be. So thank you so much for your time, Dr. Tyndall. I
You're
appreciate
very
that.
welcome. Thank you for inviting me.
Absolutely. And thanks to all of you for listening to this episode of the DrBicuspid.com podcast. Some fascinating technology coming down the way. How will it impact you? We just talked to one of the experts about that. And it's great to know that something new is coming that can really help your patients in the future. Till next time, it's Kevin Henry, editor in chief for Dr. Bicuspid, signing off. And as always, wishing you nothing but success ahead.